हाय बड़ी। तक सिर्फ एक ही बंदा है। थैंक्स। That was great. I love this conversation that we are having where it seems like मैं अपने आप से बात कर रही हूँ. I love it. Hello. How you doing, buddy? Thanks, Om's medical camp was good. It was hot. अच्छा था. चल रहा है every day. Why are there only 2 people? Oh wow, my husband has joined. Theta. Okay. Hello, everyone who's joining in. Hello. Okay, let me. Hi guys. Hello everyone. I want to get some more people to join in before I call Arfa. Yeah, or I can just call Arfa. Guys, I'm calling Arfa. Hopefully she should join if she doesn't have connectivity issues. Let me just text her. Hello, assalamu alaikum.
यस वालेकुम अस्सलाम।
मेरी आवाज क्लियर आ रही है?
हाँ मुझे आ रही है. Can you hear me?
Yeah, perfectly. Perfectly.
Okay, great.
I don't know
This
why
is
it's
the
not
first
issue हो
time
रहा
I'm
था.
doing this live session.
Usually, I like if I call someone, वो direct call चले जाती है. But I don't know अभी है technology.
Yeah.
Last time
Is
we
it just me या बाहर में कोई शोर तो नहीं हो रहा पीछे से?
no. तुम्हारी तो बिल्कुल क्लियर आ रही है मुझे. Do you
Okay,
hear?
great. क्योंकि your picture is like थोड़ी सी still हो के आ रही है. I'm just wondering if same problems happening with me.
I don't know, guys. Can you hear us properly? Everyone who's joined in, हमारी आवाज सही आ रही है? If you can let us know, that would be great.
How many people do we have, and when should we like start
So right
the
now,
session?
so कुछ लोग, so right now there's only 5 people. I think people joined in, some left. That's why I'm trying to see अगर internet की मतलब उनको कभी कभार ऐसा होता है people join in but उनको सही से आवाज नहीं आए so they leave. But that's why I want to know. Can everyone hear us clearly? I am not getting any responses from anyone. Guys, I just want to confirm if you guys can hear. Okay, Sadia Basi says she can hear us. Great. Okay, there are 8 people now. Can you see the number of people who have joined in up? Live के side में number आ रहा है. Yeah, great. Great. Do you want to wait for? I think we can start and then people will keep on joining in. Yeah. Chalo. Perfect. Okay, so Assalamu alaikum everyone. Welcome to my Instagram live. And I'm so honored that Dr. Arfa Masihuddin has joined us today.
Oh
Um,
my God.
and like, I feel like everyone who has joined in today probably knows Arfa from social media or from all the work that she's done. So I personally will not give an introduction. I want कि जो introduction आएगा Arfa से वो Arfa खुद दे. So yeah, Arfa, I'm really glad you joined in today. And how are you?
I'm good, enjoying, not exactly enjoying because weekends are also full of work.
Yeah.
But thank you first of all for having me here and thinking that I could be of some value to your followers. So I see Amna in my classes because we're both enrolled in the same courses at ATU, even though she's a community medicine resident. So, but we have a clash with some
Yeah.
of the courses. So that's when I first saw her, and I was like, I think I know her somewhere. And then we were like, yeah,
It was
that's Arfa, that's
so
Anna. That's how we recognized each
the
other.
first time. So it was so funny because I was following Arfa already on her Instagram, and then I see her story, which had this which and she had posted a story of the class that I was sitting in at that moment, and I was like, wait, we're in the same class. So that was really funny. फिर उसके बाद हमारी बातचीत basically start हुई. Yeah.
Yes, and then I'm glad that you reached out for this because actually I get a lot of people in my DMs who are like कि public health के बारे में बताएं and so many questions coming up and I was like yeah maybe I should do a post on that but this is like a good idea because after this if people have any follow-up questions then they can just
Exactly.
reach out to us. But this was
Exactly.
very much needed.
And public health, I
So
mean, everyone knows what public health is and everything, लेकिन लोगों को exact idea नहीं होता कि how do we venture into that field, right? So, and that I felt like internationally you have a lot of guidance, you have a lot of social media pages which help you, but I saw that it was completely lacking over here, and a lot of people want to go into it, but उनको कोई idea नहीं होता है उसके बारे में. So I started doing then. पहले I was doing posts, but that's when I started doing these Instagram lives with people who are
well into the field, you know, like मेरा तो ये है कि I'm just starting in, but you guys, you've been working in this field. पिछली बार जब मैंने किया था, he had been working, so you know, I was like, मुझे भी पता चले, दूसरों को भी पता चले, you know. So with that, I think we should start off with like a little like I want you to what your background is, you know, how you came into this. Not how you came into this, but just general. तुम अपना मुझे थोड़ा school का background and your education background, basically.
Right. So, okay. So I'd like to mention here that while we were having this, I just noticed that Dr. Zia Islam joined us, and he is like a big plastic surgeon, breast surgeon there at AKU. So, good to have somebody from the clinical side also here, and I'm sure he knows he'd be in there. So, but good to see clinicians also joining.
Yeah.
So yes, I'll get to the question. So yeah, I did my O levels from Springfield School, and then I did my A levels from Beacon House, and I also had English language there, and in which I had a distinction across Pakistan, because of which I give spoken English classes. Like I think you guys, all people who follow me, they've seen me doing spoken English courses for healthcare professionals and everything. So these are courses I've designed myself, because I also did, like, as I go on and tell you, I also have a certification in that. So, you know, that's how it just came about. So anyways, while I had the biology, chemistry, physics, all of that in A levels, the idea was that yes, medicine to karna hai, because, you know, I'm good at bio, I want to do that, I like interacting with people. So, you know, it seemed like the natural choice, the easy choice to go towards. Not exactly the easy choice, because medicine is definitely anything but easy, like, you know, tick mark ho rahi.
I have a follow-up question to that, like, because my journey was similar, but my question to you is, was it like कि बस डॉक्टर ही बनना है और क्या है? Was it like, was that your thinking, or
No,
was it like, did
actually
you think
not,
about
because
other?
I started off with wanting to be an economist, and then I wanted to be a political science graduate, then I wanted to be a writer, and then I came towards this. So, you know, it's a very all बहुत diverse किस्म की सब fields के साथ choose करने के बाद I came to medicine, and I was like, no, it's medicine that I want. So anyways, medicine में फिर जब when the MCAS and everything so हुआ, and then I did my MBBS from Ziauddin in 2019. I graduated. And for 2020, which was the COVID year, when COVID came to Pakistan, that's when I was doing my house job. And it was one hell of a year, and I think that timing played a very important role in helping me decide कि करना क्या है. क्योंकि COVID उसी वक्त आया था, and I was rotating in surgery, and I was I've always been very vocal about my dogma or something I believe in, and I'd be like, नहीं, ये सही है, ये गलत है, ये करना है, ये नहीं करना है. And at that time, PPE की कितनी shortage थी. So I always used to be standing up to the head of departments and be like, ये नहीं है, वो नहीं है. So they got back at me by sending me to the COVID ward. I was the first house officer, me and another friend of mine. We were like, हम दोनों को भेज दिया सबसे पहले कि ER में जाओ, कोविड वार्ड की ड्यूटी दो. So, you know, that kind of, it gave me a lot of exposure. But that's not where the story starts about the public health interest. It starts back in third year. So, because I always loved writing, I was very much into narrative medicine also. Again, those of my followers who've been like around for a while, they know that I usually medical stories, medical genre ki karti, and that's actually called narrative medicine. When I started writing about it, I did not even know that that's a genre, that that's a thing. It is, and there's even a master's program being offered in narrative medicine at University of Columbia.
Oh,
so yeah, so it's like a whole full-fledged thing. So during my third year, what I used to do was like जो भी clinical rotation होती थी हमारी, उसके बाद whatever my reflections from that rotation हुआ, मुझे क्या अच्छा लगा, क्या नहीं लगा, what problems I picked out. And that kind of started, you know, एक डायरी बन गई मेरी पूरी उस जर्नी की, my observations, my recollections from my reflections basically from what I saw medicine as. Again, moving on to fourth year and final year. Then in fourth year, clinical ज़्यादा tough हो गए, and then I happened to be at both ends, like as a caregiver also for my nanny and as the doctor also. So दोनों चीजें देखी कि दोनों side पे problems क्या हैं, and how health education, health promotion, health literacy की हमारी कितनी कमी है. I also noticed the toxic work environment that we have in hospitals. And that was something that was really beginning to bother me to the point that, actually actively started thinking about those things. फिर फाइनली फाइनल ईयर हो गया, हाउस जॉब हो गई. हाउस जॉब स्टार्ट भी जब होने वाली थी, आई एक्चुअली कंसिडर नॉट डूइंग माई हाउस जॉब एंड जस्ट गोइंग टुवर्ड्स द मास्टर्स इन पब्लिक हेल्थ, बिकॉज आई वाज लाइक मैं इस माहौल में काम नहीं कर सकती. I knew my strengths and limitations. I had figured that out, and I knew that I cannot work under that toxic environment. And then I had multiple other interests also. I liked teaching, I liked writing, I liked creative pursuits. So I was like, खाली अगर मैं residency कर रही होंगी, I wouldn't get time for that. And if I don't get time for that, I won't be me. And if I'm not me, I won't be able to be a good doctor to my patients. Even though I really enjoyed, counseling patients, and I was actually pretty good with the hands-on procedures. So एक टाइम पे I seriously considered family medicine for that, because I was like उसमें आपको hands-on भी मिल रहा है, procedures भी मिल रहे हैं, and you're getting good mix of everything. So anyways, but I still did my house job because उस time पे मैंने ये सोचा था कि career pathways खुलेंगे. I will know what to do. I'll have an option always if I want to go back into residency.
Yeah.
But now that I look back, I realize it was so much more than that. I recently did a post also on it. It's there on my feed as to all the lessons I learned from my house job. And it was some real intense character building. It was some life lessons that you learn, not just for your personal life, but also for your professional life. It was a big eye-opener. And I feel like that was a very, very important part of why I had actually decided to do public health rather than clinical medicine, because I was able to pick up the problems in the healthcare system. चाहे वो हमारी public health issues से related हो, communicable, non-communicable diseases, or just the work environment as well, the hospital problems faced by the administration, the loopholes in our entire health service delivery system. So वो एक first hand experience जब मिला और दोनों तरफ का मिला, so I felt like that was coming from a place of empathy then.
Yeah.
The whole what we call the human-centered design thinking वाली चीज. So I figured that out कि मैं जो experience किया था अब उसकी problems क्या हो सकते हैं. So if I would have ventured straight into public health without this clinical exposure, maybe I wouldn't have had the experience and the lens to look at things the way I could have. So that really helped. So house job के बाद, while my house job was towards the end, I came across this across CCIT, Critical Creative Innovative Thinking Forum at AKU, headed by Dr Arfa Masihuddin. So they were offering a 1-year health innovation fellowship. And that fellowship was, when I read the JD and I read what the requirements were and what it has to offer, I felt like it was something for me. Because it required this desire to do something in health innovation. And that really stuck with me. And I was like, ये बहुत interesting सी कोई चीज़ है जिसमें हम public health की भी बात कर रहे हैं, हम business की भी बात कर रहे हैं. We're talking about strategic planning also. And they also talked about narrative medicine. So I was sold at narrative medicine. So I was like, let's try it. Let's go for that.
Yeah.
So during that 1-year fellowship, बहुत अच्छा exposure मिला. AKU itself gives you a lot of opportunities, a lot of exposure, opens up your worldview. वो तो था ही, but उसके अलावा we used to have these different rotations during the fellowship. So when I was rotating in the emergency department with the business manager there, her name is Dr Masihuddin. So at that time she was there. So while I was there with her, I figured out कि अच्छा back end पे ये चीजें चल रही हैं. These are the problems that the administration is facing, and this is how you're dealing with it. And especially she being the woman, having to go an extra mile, having to break another glass ceiling, all of those things, that was when I figured that, okay, public health का तो interest था, but other than public health, it's health policy and management that my interest really lies in. So public health बहुत broad spare था ना, उसमें फिर समझ आ गया कि ये करना है. So then I applied, and actually AKU was the only place I applied to, and the admission happened, and that's how I came. And now here I am, and preparing for my thesis, and let's see where I end up at.
Amazing. So basically, it's not like you planned anything, but just with, how your life and the events, the experiences that happened, that kind of brought your journey to the to the place where it's at. So basically मुझे ये
I was very, I always paid attention to the opportunities that were coming my way, and also to the fact that what I can do and what I can't do. You know, I never try to put myself the fact that नहीं मैं सब कुछ कर सकती हूँ. Yeah, just because my friends are going for clinicals, मेरे सारे friends USMLE clap कर रहे हैं, FCPS के exam दे रहे हैं. But like, not necessarily. I know what my strength is, what my weakness is, and whatever decision I make has to be accordingly. So that is very important. हम लोग अक्सर pressure में आ जाते हैं, and I think that is also one reason why we don't give public health its due importance, because हमें लगता है कि इतनी कोई वैसी lucrative field नहीं है, या इसमें पैसे नहीं है, या इसमें prestige नहीं है. So ऐसा कुछ भी नहीं है. It's just wait till you come in, and then you'll see क्या actual scene क्या है.
That's true. So I wanted to talk to you a little bit more about like the journey that you've been on. उसमें मुझे थोड़ा बताओ कि during, I think you were also involved in a lot of stuff during your med school, other than your जैसे आपने बताया कि narrative medicine चल रही थी, but were you also part of some organizations while you were in med school? You can talk a little bit about that.
So during medicine, तो during that नहीं, उस वक्त तो नहीं था, लेकिन I was volunteering at various places on my own. During school years also, I used to volunteer. उस time नहीं था, but like recently, last year, I did join this non-profit organization called Msc Health Foundation. And it was an opportunity that I came across, and because I was already interested in the whole management part of it and setting up a thing, so I did like helped the chairman do the whole planning and everything. So I'm in the board of members. I'm still in the board, and it's up and running. Alhamdulillah, it's slow, लेकिन ये के हो रहा है. And that was what told me कि yes, जो मैं कर रही हूँ वो मैं सही चीज कर रही हूँ, because उसकी जो planning थी, पूरी organization की जो strategic planning होती है कि आप vision mission बना रहे हैं कंपनी का, आप उनके SOPs लिख रहे हैं, आप hiring में involved हैं, JD उसकी बन रही है, आप पूरा उसके finances budgeting कर रहे हैं, health financing कैसे हो रही है, आप patients को के लिए what protocols you are setting, quality management कैसे हो रही है, तो वो सारे काम मैं already करके आई. Like I had kind of done all the practical work when I joined the master's program, so I had that good ground knowledge.
Nice. And so, I mean, वही ना कि when you come with experience and then you start learning, तो एक added bonus होता है, you know, you're not learning from ground zero, basically. So, and this is a question that I keep getting a lot, कि you know, मुझे कोई एक्सपीरियंस नहीं है पब्लिक हेल्थ में, या मुझे कोई I want, this is something I'm interested in, but I don't know how to go about it. And I always tell people it's not about, you don't always have to land a job somewhere later, even if you start volunteering or if you join different NGOs, आप साथ साथ सीख, it is all public health essentially. So yeah. And can you also tell me a bit more about, like you said, you joined CCIT after you graduated. So I think people would also like to know कि CCIT में होता क्या है, उनका काम क्या है, and what exactly your role was over there.
Yes, so अच्छा, can you hear the azan पीछे? I think it's fine. So what actually happened was that CCIT is called the Critical Creative Innovative Thinking Forum, and उनकी जो ये 1 year fellowship थी, this taught us about like leadership roles, management, public health, research, human-centered design thinking, incubation, entrepreneurship. तो एक अच्छा mix मिल रहा था हमको इन सारी चीजों का. And the way it happened was that for 1 year, we were all rotating, like we were all taught in these subjects. We were mentored by their team. इसका हमको पढ़ाया गया था. And whatever projects they used to have, like hackathons, and they're also the Brain and Mind Body Institute. उनके साथ भी इन्होंने एक hackathon run. So all of these events that they were having, they used to organize. We used to be a part of this, and we used to assist them. in planning that. तो एक वो भी हमको अच्छा एक्सपोजर मिला एंड देन वही जो हमको पढ़ाया पूरा इंक्यूबेशन पढ़ाई एंटरप्रेन्योरशिप पढ़ाया innovation and creativity पढ़ाई like they actually we had a short course on innovation. We had it on human centered design thinking, which is becoming a thing now.
So you
And
were
it's accredited
working
by
there and they were basically training you guys at the same time.
it was a fellowship, right? So it was like a 1-year paid fellowship. Yeah, so वो बड़ा एक अच्छा उसमें वो रहा था. I have a lot of posts on CCIT also on my feed. I'll share them with you, so you can also share with your fellows.
Sounds amazing.
Followers.
So, so basically, you chose to then go forward into doing a master's in health policy and management, right? And उससे पहले तुमने decide तो सोचा था like pre-house job. Okay, I want to do maybe I do an MBA right now. I'm assuming, right? That's because that's usually what the basic thing is कि यार हम क्या करें, right? MPH is the one that अगर हमें public health में जाना है तो MPH is the field that is the most accessible or the most commonly known. So, how did you decide कि नहीं MPH नहीं करना है, मुझे HPM करना है, या एपी बायो भी AQ में ऑफर होता है, so you know those different fields.
Yeah, so yes, Abhi, I think somebody also asked here in the comments also कि what's the difference between public health and health policy management and epibio and all. So the way I always explain it is like this कि देखिए हम medicine में internal medicine है आपकी, ठीक है, उसके अंदर आपकी different sub fields and sub specialities हैं like you know nephrology, neurology, cardiology. सर्जरी है एक बड़ी फील्ड, उसके अंदर आपके यू हैव कार्डियोथोरैसिक सर्जरी, यू हैव पीडियाट्रिक सर्जरी, यू हैव ऑर्थोपेडिक सर्जरी. सो ये उनकी सब स्पेशलिटीज होती हैं. सिमिलरली यू हैव पब्लिक हेल्थ, उसके अंदर यू हैव हेल्थ पॉलिसी मैनेजमेंट एंड एपीबायो एंड यू नो इस तरीके से फिर वो निकलता है. सो इफ यू आर इंटरेस्टेड इन एवरीथिंग, ठीक है, आपको पब्लिक हेल्थ जनरली आपको मैथ्स नंबर्स भी अच्छे लगते हैं, यू वांट टू नो द स्टैट्स आल्सो, you want to know policy making also, then public health is the thing
way to go.
You know, when you want to figure out आपको knowledge चाहिए and then you want to figure out what you want to specialize in and how you want to take up your career, where you want to take up your career. And the thing is, a lot of clinicians actually opt for public health. जिन्होंने अपनी residency कर ली होती है, जो consultants होते हैं, जो clinical medicine practice कर रहे होते हैं, they go for public health and because वो उनको एक holistic overview मिल रहा होता है.
Yeah.
And for them it's helpful because you know वो हर चीज के अंदर वो apply कर सकते हैं. So like I said, health policy हो गई, health policy management हो गया, epibio हो गया. These are more specialized. Epibio deals more with the stats, with the numbers. It deals with the prevalence of diseases, the incidence of disease. Health policy and management, like the name tells you, is about policy making and hospital administration and all of those. So if you haven't figured out कि आपने policy making में ही जाना है, management में ही जाना है, then it's a very easy choice. Like it was for me. Even though I had straight A's in math, even had A-level math and I had an A in that, I did not enjoy it. I don't enjoy it. अभी भी जो हमारा stats module गुजरा था, I tried.
है ना कि आप डॉक्टर बन रहे हो तो मैथ से भागने के लिए बन रहे हो.
Yes, but even though I just didn't. At this point in life, I believe I just don't enjoy math. And मैंने figure कर लिया था कि I am more interested in planning, in making policies as compared to learning the stats. And here I definitely like to mention that my focus has always been towards humanistic medicine. Again, those of people who are following me, they know I run the society
for that also. Yeah.
Yeah. So during house job ही हुआ था कि when I figured कि मुझे health management की side के ऊपर हो रहा है उस वक्त. So then I figured कि okay, this is what I want to do. And there are a lot of research papers also actually published on humanistic medicine. So when I applied to this HPM program, that's what I wrote in my personal statement also, and that's what I told the director and the chair in the interviews also. That humanistic medicine is what I want my research to be in. That how can we integrate that into a lower middle income country like Pakistan, and how can we incorporate that internationally into our health policies and management? Because वो पूरा related ही उससे था. So I knew from the get-go that ये मेरा problem इससे है. again I identified the problem. What is it that really speaks to you? आपको मसला किस चीज से है सिस्टम में? आपको मसला इस चीज से कि रिसर्च के लिए आपके पास स्टैट्स नहीं है, या आपको मसला इस चीज से द वे थिंग्स आर रनिंग. सो यू नीड टू फिगर दैट आउट कि दुखती रख कौन सी आप. I figured that out, and for me that was how things are run here. So that obviously made common sense in health policy more. So I figured that doing this was what interested me. I went through the course objectives, I went through everything, I looked at what the alumni was doing, I spoke to a lot of people who had already done it, and then again, you weigh with your own pros and cons. It's never just you, and it's never just the degree. It's always a mixture of both. Okay? Just because maybe every like cardiology is supposed to be the big thing does not mean I have to do that. If I enjoy dermatology more, it's completely okay, right?
Exactly.
You just need to be confident and you need to faith in yourself. So बस वही था, मैंने फिगर आउट कर लिया था. तो मुझे ये था कि यार मैं क्यों एपीबायो पे टाइम वेस्ट करूँ, फीस भी रिसोर्सेज भी उसके ऊपर, या क्यों पब्लिक हेल्थ की तरफ जाऊँ जब मुझे वो ब्रॉडर पर्सपेक्टिव नहीं चाहिए, मुझे बहुत स्ट्रीमलाइंड होके करना था. So, I figured that out.
Yeah.
And what I would tell everybody who is interested in it is that देखो सबसे पहली बात, make Google your best friend for this. So, symptoms Google करते हैं लोग, इस हर तरह के टोटके Google करे होते हैं. इससे बेहतर है कि आप ये वाली चीज़ जो आपको actually काम आने वाली है वो Google करें. And go to the sites that are actually authentic. जैसे कि you Google maybe के public health universities in Pakistan. There's a whole list. You don't have to ask me or ask anybody else कि कौन सी है. आपको वो Google बता देगा और बहुत अच्छे से बता देगा.
That's why I
Similarly for
yeah.
So you do that. You'll get a list of universities कि public health की कौन सी हैं. उसमें से just pick the top ones, because obviously top वाली जो है वो better आपको एक overview देगी कि क्या ऑफर कर रहा है वो in terms of job prospects also या नहीं. Because I see a few questions here, okay, what are the job aspects, is it worth it in Pakistan or not? So I'll just come to that also. So look at that website. उस पूरी वेबसाइट को अच्छे से पढ़ ले, उसके प्रोग्राम में क्या ऑफर कर रहा है, व्हाट आर द प्रोग्राम ऑब्जेक्टिव्स, हु इज इन द फैकल्टी, उसका चेयर कौन है, उसकी एसोसिएट प्रोफेसर्स कौन है. Go to their profiles and check it out. Go to their LinkedIn profiles and check the work that they have done. उन्होंने कौन से research papers publish की हैं, how high they're rated, all of those things. So getting a good insight into the faculty of those universities will also give you a very good idea कि उनकी job placements कहाँ हैं, because obviously जो पढ़ा रहा है वो subject आपको उनको बहुत अच्छे से उनसे आपको काफी अंदाजा हो जाता है, right? So when you look at those universities websites and you look at whatever information they're offering you, if you have any additional questions, you can just email them directly and ask, and most universities do it now. Right? तो इससे आपको एक बहुत अच्छी information मिल जाएगी in terms of everything, कि कौन सी university का कितनी duration का course है, what are they offering, even job prospects, everything, it's usually given over there. Coming to the job prospect question, देखिए, with public health, once you've done that, the options are limitless. ठीक है, बाहर ज्यादा इसका स्कोप है as compared to Pakistan, but now it's picking up pace in Pakistan because field saturate होती जा रही है, clinical medicine saturate होता जा रहा है. People are beginning to realize, I don't know whether it's for the wrong reason or the right reason, but बहुत सारे लोगों को ऐसा लगने लगा है कि clinical medicine is also not paying them enough as much as they would like.
I mean,
so what they're going to do is
alternate a big factor where people are also merging both these things together, And in Pakistan, that's a big factor.
Absolutely. Yeah, right. So वो बात भी है. So ऐसा नहीं है कि इसमें ज़्यादा पैसा ही नहीं है. I think it's just how you look out for opportunities and how you manage to do that. अब अगर बाहर का है Pakistan, something it's very saturated. See, it's public health is not really saturated in Pakistan. I just feel like लोगों को सही direction नहीं है. They don't know where to look for jobs. And they're so desperate to get a job कि वो गलत job भी मिल रही होती है, misfit भी होती है, so वो ले लेते हैं. ठीक है, that's what I have felt. So I actually made a list of the professions that you can go into once you're done with a degree in public health. So there are lots like health informatics specialist, healthcare administration, of course, epidemiologist, public health project manager, health and safety engineer, public health educator, health coordinators, nutrition officer. There are a lot of opportunities for WHO. You can always join WHO and work on their various projects that are going around. That's what I meant when I said public health project manager. Then regional head for different health services. There are big hospital networks that we have. I'm not naming anyone here. बट बहुत सारे हैं जिनके
Yeah.
आप सर्विस के हेड बन सकते हैं if you have the experience, you have the expertise. Then there is a health management director. You can join NGOs, you can join the government, and there are other donor agencies also, international donor agencies. Red Cross हो गया. Um, what is that? Okay, I'm forgetting the name, but there are like a lot of international also donor agencies and health agencies that are working. You can join those. You can even become a health entrepreneur, which is the field that I am going to be picking for myself. See, I always believe कि लोग एक चीज ये भी बोलते हैं कि मेडिसिन कर ली तुम उसके बाद अपनी फील्ड चेंज कर ली जाया कर दी.
This is one
मतलब
of the big,
I really don't know.
yeah, and you know, this is like a stigma within our society. अगर आपने MBBS करके किसी कोई और फील्ड में आप चले गए, and especially like अगर आप public, I'm not saying you're not working, you're like आप पब्लिक हेल्थ में जा रहे हो, तो एक वो आ जाता है कि ओह अच्छा तुमने डॉक्टरी छोड़ दिया है, तुम डॉक्टर नहीं हो. एंड आई फील लाइक दिस इज अ लॉट ऑफ people are now yes realizing कि हाँ ठीक है, this is a valid field, but लोगों को convince कर, and I'm sure you must have faced this as well, that when you shifted your field from pursuing clinical, बहुत लोगों ने पूछा होगा कि क्या क्यों कर रही हो ये, कि क्या मतलब है कि तुम्हारा काम क्या है exactly, you know. So this is something that with time I feel like it will disappear, but it is taking its sweet time.
It definitely is. You know, change never comes
Yeah,
over a day. It does
yeah,
take a lot of time and effort. And again, it's about how we project it as public health
exactly,
specialists, how we
exactly.
project it. So, you know, one thing I wanted to say was that a degree alone is not going to make you worthwhile, or it's not going to get you a job, or it's not going to help you establish yourself or go big. It's your own personal capabilities also, and
Right.
your how focused you are on your own personal and professional growth.
Right.
Right, just like हम medicine करने के बाद एक BLS also lasts for 2 years, 3 years. आपको हर साल refresher course करना होता है, चाहे वो BLS का हो, ACLS का हो, any surgical skills, whatever it is, you need to do those. Similarly, for every field, you need to keep on polishing yourself, and you also need to keep on figuring out what you are good at. Maybe there was something you were good at previously which you're not. तो जो आपकी अपनी set of capabilities होती है, वो combined with the degree is what is going to get you where you will be. It's
Exactly.
neither one of those alone. Like आपके पास नॉलेज है. अब जो मैंने जो भी अपनी इस मास्टर्स डिग्री में मैं पढ़ रही हूँ, नॉलेज तो आ गई ना मेरे पास, स्किल्स भी आ गए. हाउ आई पुट देम टू यूज इज अप टू मी. Whether I choose to join WHO and I work for them, or whether I choose to have my own healthcare company and then उसका जो मैं प्रॉब्लम जो भी टैकल करना चाह रही हूँ, skills तो आ गई. The opportunities are endless. You can literally do anything with these knowledge.
And
उसके अब जो आप पढ़ रहे होते हैं
yeah,
उसको देख लो. कोर्स ऑब्जेक्टिव्स में बता रहा होता है बाय द एंड ऑफ दिस लेक्चर यू विल बी एबल टू डू दिस. So why not actually be able to do this? That is exactly the JD. Just look for places that are doing that. Like for instance, I've been very interested in healthcare management and specifically for women. So you know, I was just looking these up and I figured that there are actually international companies out there on healthcare consultancy and healthcare management, which Pakistan में तो जिसका किसी को पता ही नहीं होगा. So you know, it's
you
just a
have to
search away, a Google search away.
exactly.
You
And
have to connect with people. You
the
have to
the
be
so
connected to do that.
again, you know, pointing back to your previous point कि भाई आपने people think कि choosing public health after a clinical track is choosing a soft option, but the thing is पब्लिक हेल्थ ठीक है हमारी कॉल्स नहीं होती हैं और उस तरह का हमारा हेक्टिक स्केड्यूल नहीं होगा, बट you have to keep on pushing yourself, you have to keep on advertising yourself, you have to keep on looking for opportunities. And this is where, you know, different media, social media platforms like LinkedIn is a very, and you are on LinkedIn, you know, and you're a big thing on LinkedIn, and platforms like that are a very crucial tool in order to find out about new things, in order to meet new people. So हमारे उसमें
Yeah.
ये है कि we need to keep kind of एक तो आप 9 to 5 जॉब कर रहे हो, but then you need to keep on figuring out what are the new avenues that you haven't reached. You need to keep on connecting with people, which maybe in clinical fields, I'm not saying it's not important, but वहाँ पे इतनी उसमें उसको focus नहीं किया जाता है, right? Here, that is the main focus. So, I think ये
And it's not like the public health people have it easy. I mean, बहुत field work होता है इसमें.
Exactly.
You have to go on field. You have to make feasibility plans. There's a whole way in which you figure out कि कौन सा आपको प्रोग्राम जो है कौन सी कम्युनिटी के लिए करना है. ये जो हम पोलियो कैंपेन्स आप लोग देखते हैं, टीबी कैंपेन, वैक्सीनेशन कैंपेन्स चल रही होती हैं, ये क्या है? दिस इज ऑल पब्लिक हेल्थ. हाउ टू मेक दैट वैक्सीनेशन प्रोग्राम, लॉन्च इट इन अ कम्युनिटी, कितने लोगों को हायर करने हैं, कौन सी फैसिलिटीज उनको देनी है, किस पॉपुलेशन को टारगेट करना है, कैसे करना है. इट्स नॉट इजी एंड यू नीड टू नो the disease pathophysiology, also the epidemiology behind it all. इतने लोगों में हो चुका है, मजीद हमको इतना डेटा लेना है. Public health is basically what catalyzes research, that it is what catalyzes research. जो डेटा हम पब्लिक हेल्थ से या जो एक्सपीरियंसेस हम पब्लिक हेल्थ से निकाल के लाते हैं, वही आपकी रिसर्च कंट्रीब्यूट कर रहा होता है. एंड इफ इट वाजंट फॉर रिसर्च, मेडिसिन वुड बी नोवेयर.
Exactly.
Right? So, ये चीज, another thing that I was just gonna add was that ये point जो मैंने यहाँ भी देखा कि लोग बोलते हैं कि आपने डिग्री ज़ाया कर दी ये वो. So again, if it had not been for medicine, if it had not been for the clinical exposure I had, चाहे वो छोटा हो, कम हो, ज़्यादा हो, बहुत ही कम, 1 साल हाउस जॉब का पीरियड था, लेकिन उस 1 साल ने मुझे इतनी सारी चीजें सिखा दी, which got me to where I am and which made me decide what I want to do with my career. So an experience never goes to waste. It's just on how you tend to use that experience. ये वही बात हो गई कि you have social media. Now it's up to you whether you watch trash on social media or you follow educational videos or you use it to make yourself better. At the end of the day, it's all up to you how you do that. And like you were mentioning LinkedIn right now, LinkedIn has turned out to be a really great tool. And कहा जाता है कि डॉक्टर्स के लिए या हेल्थ केयर के लोगों के लिए नहीं है, but that's not true. You go and see there, majority of the researchers there have very up-to-date LinkedIn profiles. They've shared their research papers there, they share seminars and workshops they attend there, and that's how you come to know that, acha, this is the innovation happening in healthcare, this is the innovation happening in medicine. You connect. It leads to a lot of opportunities. I've met a lot of people over LinkedIn with whom I've connected, and because of whom I have learned a lot of new skills. I've learned a lot about public health. I've learned a lot about medicine. I've learned a lot about health innovation, which is something I'm interested in. And I'll just give you an example. It was through LinkedIn that I actually came across this thing called the American College of Healthcare Executives. And all those people who are asking कि job opportunities क्या हैं, scope क्या है, तो again, scope is also something that you need to create, right? That you need to income, like उसके लिए आपको भी मेहनत करनी होती है. इसी की एग्जाम्पल ले रहे हैं. For anybody who is looking to settle abroad, maybe in the US, तो just like USMLE certification है for internal medicine, for medicine, sorry, not internal, for people who want to practice medicine in US. Lab certification है for people who want to practice medicine in UK. इसी तरीके से there is a certification called fellowship by the American College of Healthcare Executives. ठीक है, so it's you can find them, Google करेंगे आपको मिल जाएगा, LinkedIn पे भी इनकी प्रोफाइल है. It's an exam that you have to pass. After इनकी कुछ prerequisites होते हैं, you have to be eligible for, पहले उसको एग्जाम के लिए आपको eligible होना पड़ता है. And if you pass that, you get certified, and that lasts you, and then you can practice as a healthcare administrator in the US. And then you talk about कि इसमें पैसा है या नहीं है, वो आपको यहाँ पाकिस्तान में मिलेगा. If you get a government job, if you get a job with WHO, or even if you want to start your own company, you're definitely going to get it. And आप लोग example देख लें, जितनी भी telemedicine companies हैं हमारे पास, they started like that, but now they do have team members on board who are public health specialists.
Exactly.
So there you go.
Exactly. Like it's this. I feel like also, everyone wants to aspire to go abroad, which is great. But जब आप बाहर भी जा रहे हो ना, काम आप इन्हीं lower middle income countries के लिए कर रहे हो, right? You're not going to go to the US and the UK and work for people living in the US and the UK, for projects over there. Most of your projects will be directed over here. So, like, not, saying anything against people who want to go abroad, but I feel like जो opportunities आप लोग को यहाँ पे मिलेंगी ना, staying in Pakistan, working with your community, dude, a lot of times ये होता है कि people from, say, a relative socio-economic status, उनको पता भी नहीं है ground reality है क्या. राइट? जब तक जिसको पब्लिक हेल्थ में काम करना है, जब तक वो जा नहीं रहा है फील्ड में, जब तक वो देख नहीं रहा है कि एग्जैक्ट लोग किस हाल में रह रहे हैं, एंड लाइक यू मेंशन, यू नो, योर clinical experience, you saw how it was happening. I worked at civil. My reasoning to do the house job was the same. Like I wanted to see, okay, is clinical the route I want to go to? And एक साल मैंने हाउस जॉब अपनी सिविल हॉस्पिटल कराची में की थी, एंड आफ्टर आई डिड दैट आई सॉ people from all over Pakistan, from the lowest of socioeconomic status, and I came out of my house job thinking the same कि भाई काम इन्हीं लोगों के लिए करना है. People who are living in developed countries or people who have the means to provide a good life for themselves, they're doing okay, even living in a low middle income country. So, you know, living in Pakistan, you have the opportunity to kind of see the communities that you will be working for, no matter what organization you're working in. And I think that experience is, if you apply anywhere abroad, and this is why I keep telling people to look for volunteership at NGOs and stuff, because again, if you're applying for a master's abroad or if you're applying for work abroad, this kind of experience is what elevates you, because you know कि ground reality क्या है जहाँ से आप आए हो, you know. And like, so
Uh,
go on.
go ahead.
No.
No,
There
go.
was something. No, I was just gonna say, like, because I get a lot of questions also about कि भाई अगर masters करना है तो यहाँ से करूँ या बाहर से करूँ, you know. So I figured that is something that you can answer better, considering you opted for the master's track.
So you see, when you're choosing a university, that's again there are a couple of things that you need to choose, that you need to keep in mind. And उसमें यही आ जाता है कि why do you want to go abroad first of all? And I'm not saying is a bad thing. I'm just saying you need to know there is a certain thing you want to do or you don't want to do. You need to know why, the why. So you need to know कि अच्छा बाहर जाके करना है या पाकिस्तान से करना है. अगर बाहर जाना है, you really want to go abroad. Why? Is it because of prestige? Is it because you can show off in your friend circle, or is it because you really think that the courses that they being offered there are worthwhile? Are they are better than what is being offered in your university, in the local university? Then again, money plays a big role. Can you afford to do that? Are you going to go in that if you take loans? Or do you think you will have to? I mean, the way things are going, if you can get something good at a lower cost, then I think that's fine. It's not a big deal. ये वही बात है हमारे जैसे हम मेडिकल यूनिवर्सिटीज के लिए बोलते हैं पब्लिक हेल्थ और प्राइवेट वाले एंड में हर जगह एक ही जगह पे होते हैं. So, and like I keep saying, it's your own personal motivation also, and your own personality traits, your own strengths and weaknesses that take you a long way. So when you're considering choosing between Pakistan and US and abroad, I think a very big factor is definitely money. Can you afford to pay for that or not?
Yeah.
If you feel like आपको बहुत loan लेना पड़ेगा and it's going to be, very, very straining on you and your family, then I would say no. Nothing is more important than your mental peace.
True.
Nothing is more important
I
than
would also like to add here though कि
a lot of, yeah.
No, I was just gonna say कि यहाँ मतलब अब there are a lot of options for scholarships also. Competitive है लेकिन है, you know, and people don't like. I feel like a lot of people back out कि यार बहुत competitive है नहीं करेंगे. But if you have experience, then लोगों को बहुत आसानी से मिल जाती है scholarship, because this is the kind of population they're also looking for to give the scholarships to, you know.
Exactly. And there are a lot of scholarships out there. You just need to be looking and looking in the right places. Most of the times, these universities, I get a lot of questions about this, how do you get a scholarship in EKU? See, it's not about EKU, it's about any university. Wherever you will go, they all have these scholarships. And जब आप एक मतलब program में enroll हो रहे होते हैं, so you tend to, they automatically give you that information that we have XY scholarship coming up, applications open for this scholarship, so you apply and you find out also from the program office, from your department, from the student finance office, right? So you need to be on the lookout for those, whether internationally or internationally. आपको दोनों के जगह के लिए the university that you're looking at will guide you about this. So एक तो ये फैक्टर हो गया in which I've answered both the things कि scholarships कैसे मिल रही होती हैं, आपको खुद पूछना होता है, and universities खुद भी बता रही होती है, so when the opportunity comes you know what to do. Secondly, when you're choosing the universities, financial aspect के अलावा, then you also have to look at the faculty, उनके जो course offer हो रहा है, the program objectives, is it what you want? ये चीज बहुत important है. So like when I was doing it, and obviously the university is ranking. Yeah, okay. AKU now is like, I think it's one of the top 20 public health universities in the world, amongst the top 20. So that is like a big deal. And top 100 in Asia, and top 500 in the world. So, I mean, I would definitely go for AKU then, like, why not? It's the same city. And, you know, वही बात है. And secondly, at this point, आपकी जिस जब आप apply कर रहे होते हैं, wherever you are at that point in life, that matters too. Some people want to go abroad at that time. Other people want to but cannot. And there are people who don't want to and cannot. So neither to those points emotionally also.
Yeah.
You know, if you feel you're strong enough to move away from family, living outside is not easy. If you feel you're strong enough to deal with all of those things, then sure, by all means go. It's not that I'm discouraging anybody from going abroad. I'm just saying that जब आप डिसाइड कर रहे होते हैं ना, तो हम लोग अक्सर ये नहीं नोट करते कि कैन वी इवन हैंडल दैट. डोंट अंडर एस्टिमेट योरसेल्फ, बट आल्सो बी वेरी ऑनेस्ट विद योरसेल्फ अबाउट. सो अगेन वही बात है, आप वही चीज यहाँ से भी कर सकते हैं, आप वहां से भी कर सकते हैं. It's about what you want to do. Maybe going abroad is better for you because there is वहाँ की जो faculty है उसका कोई एक जो you know they specialize in a certain research area. For example, maternal and child health, and that is something you're big on, you're passionate about, then definitely go for that university as compared to some other. So this is how we will figure out. But personally, I don't think there is any big difference unless, of course, it's John Hopkins you're going to. Then, you know, the biggest public health universities.
I have a question for you on that. यहाँ पे बहुत मैंने सुना है कि यार मास्टर्स के लिए ना बाहर से करो तो एक ठप्पा लग जाता है कि आप बाहर से करके आए हो. I'm not counting AKU in this. I'm counting the other local universities who are offering masters as compared to कि जब बाहर से मास्टर्स करके आओ ठप्पा लग जाएगा, आराम से जॉब मिल जाएगी. What are your thoughts on that?
So यार okay, again यहाँ पे आपके ना कुछ personal set of beliefs भी आ जाता है.
हाँ.
So my personal belief here is that your risk is predestined. जो आना होगा, जो रिस्क जहां से आना होगा वो आएगा. That does not mean कि मैं हाथ पे हाथ रख के बैठ जाऊं. My friends here who have joined this, they will vouch for that. I'm a workaholic. I really work hard. I started Walking Cause, which is my startup when I was in 4th year. It's still there. I'm planning on having another one. So ऐसा नहीं है कि मैं एक place of privilege से बात बोल रही हूँ या मैं इसीलिए बोल रही हूँ because I haven't worked hard. That's not the case. It's just that the जॉब अपॉर्चुनिटीज बहुत सारे लोग ऐसे भी होते हैं जो बाहर से करके आते हैं लेकिन उनको फिर भी यहाँ नहीं मिल रही होती फॉर XYZ रीजंस. जो यहाँ से किए हुए लोग होते हैं उनको बाहर बहुत अच्छी जॉब्स मिल जाती हैं. दे डू देयर मास्टर्स फ्रॉम यूनिवर्सिटीज इन पाकिस्तान एंड एंड अप गेटिंग really good jobs over there. So a lot of factors play a role in that. You can't just say कि सिर्फ बाहर की डिग्री करके आऊंगा तो मुझे यहाँ जॉब मिल जाएगी. It's never just one off. Lot of things. How you network. For doctors also, networking is very important. आप network कैसे कर रहे हैं? Are you looking at opportunities? Are you looking at the right places? Are you utilizing your skills the right way? So, you know, all of these things really matter. So it's never just one factor. If you feel कि अगर you have everything else covered and you feel like कि हाँ अगर मैंने करके आ गया बाहर से तो फिर मुझे ज़्यादा यहाँ पे opportunities मिलेंगी, then sure, but then consider all aspects. You know, वही है एक SWOT analysis कर लिया करें before you make anything. Yeah,
anyone who doesn't know what a SWOT analysis is, it's a very big public health term also.
Yeah, yes.
But no, that's true. Like, you have to, you know, we can't answer that question for you कि मैं क्या करूं. You know, you have to kind of see आपकी life में at that point, what works for you, what doesn't work for you. You have to weigh out your own pros and cons. And then only you can make that decision for yourself. We can only provide you with facts, you know. So yeah.
And like I get so many people in my DMs who are like, should I do it from here or should I do it from abroad? I'm like, I really can't answer that for you.
Exactly.
I can answer it for myself, but not for you. This वही बात है. You need to consider so many things. आपको वहाँ बाहर degree करनी है. What are the field you want to specialize in? You know, that also matters. For example, if somebody is very big on climate change, climate change is rightly so is a hot topic and a lot of research money is being invested into that. So if you feel like there is a university that offers you good grants and maybe PhD opportunities and a lot of work opportunities on that, then go for it. And again, आपके अपने personal circumstances भी बहुत matter करते हैं. You know, the kind of support you have from your family, your personal finances, whether or not you feel like you're in that place in life where you can go and take that decision and do that. So there are so many things, you know, some people have a lot of responsibilities, they can't. Some people don't and they're like, you know, this is that point in life where I can actually do what I want to do. So बहुत सारी चीजें होती हैं. आपको अपने आप का भी एनालिसिस करना होता है, आपको उस इंस्टीट्यूट का भी करना होता है, आपको अपने फ्यूचर का वे यू वांट टू बी at that point in life with 30 years, 40 years down the lane. That is also you have. So nobody can answer that for you. You can Google stuff, you can ask people about their experiences, how it has been for them, but you really can't ask somebody, what should I do?
That's
you know?
true. So basically now I wanted to kind of touch on ke, you know, given कि तुमने अपना masters, I think you're 8 months into your HPM, right? So have you decided? I mean, you kind of shed light upon कि you want to do entrepreneurial public health, but do you have like a focused idea कि अच्छा अब मुझे एक step ये करना है, step ये करना है, step ये करना है, and like can you guide me and us kind of through के what are your future plans for yourself?
So yes, I'll come to that. But before I do that, I just wanted to shed a little light on the master's program at AKU because ये मुझे बहुत questions आते हैं and अभी मैंने कुछ यहाँ पे भी देखे. So admissions, see again, okay, so you can just get this information from AKU's website also. कि आपको admissions कब open हो रहे हैं and I'm only answering this because I get this in DMs and अभी मैंने कुछ यहाँ पे नीचे comments लोगों के देखे थे. So I just thought I'd address those also. So आपको website पे dates, admission dates पता चल जाती हैं, admission कब है, last date कब है, form कब fill करना है, you can get everything from there. So please make use of Google the right way and find out. Usually start in April, August में उनका test हो जाता है. फिर अक्टूबर नवंबर तक इंटरव्यू कॉल्स आते हैं एंड देन दिसंबर तक जाके फाइनल लिस्ट आपको मिलती है, ठीक है. एंड टेस्ट इज like the sample paper is there on the website. You can just look at the topics that are there and then you can practice the math and the English sections if you want from the SAT or the GRE books. फिर उनका एक subject specific part होता है टेस्ट में जिसमें obviously public health related questions होंगे if you're applying for public health, which is to test how much background knowledge you have. तो वो तो बहुत analytical questions होते हैं वो, so it's pretty simple. Interview में of course क्या होता है, we could do like another session on that, so I'm not going to go into the details, but the overall program so far in these 8 months, what I figured has been very structured in the sense that I've seen students, I've interacted with students of master's programs from other universities also, and I feel like here in this sense they are organized in the sense कि हमारे ऊपर वो वाला burden नहीं आता जो मैंने बाकी लोगों पे. So you know, ours is like a full-time program for 2 years and then part-time 4 years का program होता है. And the kind of courses we have, it has been on comparative organization of healthcare systems, organizational management, principles of public health, biostats, research design and methodology, protocol development, HR for health, health policy formulation and analysis, quality management, health sector reforms, health promotion and advocacy, strategic planning, cost evaluation, and ethics. So, you know, I was just giving you a rundown of the courses that we have in our program. And so far, I feel like, yes, my knowledge bank has improved, my skill set has improved, my analytical skills has improved, and I have learned apply all of the knowledge I've learned and like real time projects because हमारा hands on भी हमको करवाते हैं, field visits होती हैं and the kind of exam techniques that they have and the way they test us is like actually you want to apply yourself and you figure it out. So I'm very satisfied and very happy with how the program is going. Now, to answer Amna's question as to do I know ke kya hai? Yes, I do. But again, I was fortunate enough to figure it out पहले ही कि मुझे किस field of interest में मेरा है. So yes, I know what I want to do, and it's going to be in humanistic medicine. You can stay tuned to my page for more information on that and the work that we will be doing. मैंने अभी recently webinar organized भी किया था on conflict management for healthcare professionals.
I saw that, yeah.
And that was about how you handle conflicts at your workplace. ये बाकियों को तो सिखाते हैं, पर डॉक्टर्स को कोई नहीं सिखाता कि HOD से कैसे बात conflict resolve करना है,
और सबसे मस्त डॉक्टर्स के पास ही होते हैं
और उनके पास होते हैं बेचारों की, क्योंकि वो 24/7 भी तो ड्यूटी पे होते हैं.
Exactly.
So it was the response was really good, and I'm planning on organizing another one very soon. So yes, I know that humanistic medicine is what I want to be pursuing, not just for my masters but also after that. And again, जब आप अपना यही interest areas देख रहे होते हैं ना, I think it's very important that if you have a public health degree, then you do a lot of research and you read research papers. One research paper will give you 10 ideas.
Yeah.
So you just need to keep an open mind with that.
That's true. And I think that is something that you can start at a very, मतलब आपको graduate होने की जरूरत नहीं है. ये हम, I don't know how Ziauddin was, but like I'm from Dow, so this is not something that was inculcated कि हम clinical side तो बहुत पढ़ते थे, लेकिन उसके impacts हम इतने नहीं पढ़ते थे, right? हम जो है like community medicine जो होती थी was very like अच्छा ठीक है renal module हो रहा है उसमें थोड़ा सा इतना आ गया, right? But like you mentioned, so research is a very big part of public health, but it's not the kind of clinical, just not research people who are from clinical backgrounds, they know that clinical research is a specific type, right? So when I was studying it, I hated reading research papers. मुझे नहीं पढ़ना था कि diabetes के अंदर molecular status क्या होता है. That's not something I was interested in. But then I came here and I started reading public health research papers, and it's a completely different ball game. उसी तरह लिखा हुआ होता है, but it's just you see the impact, of आप जो clinical side पे कर रहे हो तो उसका impact आप देखते हो. And I think that is something that's very important for undergraduates who are maybe not thinking कि आगे public health करना है, but they need to think about कि हम जो पढ़ रहे हैं उसका impact लोगों की जिंदगी पे कैसे पड़ रहा है, right? And this is something that can very easily be started at a undergraduate level. Even if your university is not, offering this is something that you can start searching for yourself कि भाई अच्छा आप जो भी आपका module चल रहा है, read some interventions that are happening and whether those interventions have been applied to a public health focus, and a lot of people confused कि जी public health में जा रहे हो तो सिर्फ research है. It's a big part of it, and I'm sure it's not just epidemiologists who are doing a lot of research, but generally तुम health policy कितने papers हैं, कितने every aspect evidence based,
Yes.
XYZ, and we don't know about that until you start, if you do your masters or if like I'm doing my residency, तब आपको पता चलता है कि अच्छा ठीक है, सही है, ये भी चीजें हैं. And this is just, I feel like something that people need to inculcate within their studies, whatever health background कि आप allied sciences में हो, आप public health की भी अलग से degrees आ रही हैं, उसमें तो पढ़ते ही होंगे, but clinical sciences में ये आप नहीं पढ़ते हो ये सारी चीजें. So people have no idea कि कितना जो है public health exactly होती क्या है, बस उनको एक term पता होता है.
You're very right. That's a very good way in which you can figure out an interest area, and this is again something that should start. That everybody should start like third year. In fact, I feel like first year से करते तो ज़्यादा बेहतर है, because first and second year is basic sciences, and you have much more time on your hand. You have much more potential to be inspired.
Yeah. You know what's funny? So, हम लोग जो है MBBS स्टूडेंट्स को पढ़ाते हैं, राइट? लाइक वी डू ट्यूटोरियल्स एंड द लेवल at AKU that they teach community medicine to these students, जो हम लोगों ने मास्टर्स के कोर्सेज में किए थे एपी बायो में, वो इनको फर्स्ट ईयर में पढ़ा रहे हैं. Like they're teaching them study design, and second year में इनको health finance पढ़ा रहे होते हैं, and I'm just like, I didn't even know about these things till I started working.
Exactly. We're masters now. But see,
Exactly.
that's good, right? How each institute wants to bring up its level. I mean, there's a reason, and then we want to compete. To compete, competition is good. I'm all for healthy competition, but then also we need to upgrade ourselves too.
Exactly.
And also everybody asking है because सबसे ज़्यादा most frequently asked question यही होता है public health में job opportunities का scope का. So everybody should just go and check out LinkedIn. LinkedIn पे आप search word में type करें public health, epidemiologist, health policy management, उन related pages भी आएंगे और लोगों की profiles भी आएंगी होंगी जिन्होंने उसको अपना keyword डाला हो.
Yeah.
And you will see a lot of positions opening up. That's a really good way for you to figure out the job market क्या है इसकी. And people who are actually employed in these positions. And this isn't just Google search, this is just people who are actually employed in XYZ companies or organizations. So that will give you a very good idea.
That's true. I think we'll do recurrent sessions of, how someone can actually use these tools to get ahead within their career. It's maybe, I think, itni guide nahi shared hui hai. Matlab, I've been learning through trial and error. I don't know about you, but there hasn't been
I'm saying, trial and error. ऐसे, you figure out this works, this doesn't, and whatever works, you tell other people, okay, this works.
Yeah, exactly. Any questions from anyone else? हाँ, I just want to, जो हमने दो ने सवाल पूछा है, उसके तो हमने जवाब दे दिए हैं.
हमने काफी सारे तो दे दिए हैं. Okay, someone's asking if they can connect on LinkedIn. Yes, the profile is the same username वही है, so yes, you can.
Amy_Usmani, if this is our question and answer session, आपको जो भी सवाल है आप अभी पूछ सकते हैं. Anyone else, if they have any other questions for Arfa, please go ahead.
Acha, also it's Arfa, not Arfa.
I'm so sorry.
No, I'm sorry. Maybe end में correct कर रही हूँ, but
Guys, any questions
I don't think we have any questions.
अभी पूछ लो, वरना हम फिर सेशन खत्म कर देंगे. Chalo, I mean, this is also going to go on my post. So anyone who has further questions after they listen to this, maybe they can ask on that. Yeah,
can you have that this post with me so that it appears on my profile also, and then people can I don't know how the settings work.
I need to figure that out because I don't know how that works. I need to Google that.
Okay, you can just tag me.
Maybe.
I think you do partnered post or something. If you have a public account, then you can do that. Partnered post.
Okay, let me figure that out because ये अभी आ रहा है. किसी ने लिखा है, मरियम माज ने लिखा है, लेटर ऑफ इंटेंट में क्या लिखना है?
लेटर ऑफ इंटेंट में उन्होंने आपको बताया हुआ होगा कि you need to highlight these things. So for us, it was like, why do you want to do this degree? How have your past experiences helped you? And what do you plan for the future? So, they had given us those points. So you have to link them together and come up with your own narrative, your own story. So, ये लिखना होता है. अगर उन्होंने कुछ नहीं बताया है, then again, you can just look up a letter of intent, as the name gives away, that why do you want to be doing this degree? And usually it's like a personal statement, a statement of objectives. So यही points cover होते हैं कि क्यों ये डिग्री करनी है, फ्यूचर में what do you want to do with this, and how have your past experiences helped you to come to this one.
Great. So Lifestyle with a Dentist has asked, how do you approach the government for any change in public health policies? That is the question.
That is the question. That is what we're figuring out.
Yeah, it's so difficult. Abhi मैंने recently we worked on this project for lead and paints, and I was working with the faculty, Dr. Zafar. हमने पूरा काम उस पे कर लिया. Policy paper एक था वो भी बना दिया. And then because Dr. Zafar had contacts, so he had emailed it to everyone. 4 महीने हो गए किसी का जवाब नहीं आया है. So it's and
That's why we need to change that scope. And the only way you can change that is when you are at that position, you make sure you don't become one of those.
Exactly.
That is the only solution to it comes to. नीचे से हम कुछ नहीं कर सकते. Get to that position, and once you are there, make it easier for everybody underneath you and for your country.
I mean, so when it comes to changing policy, I think at this point, at our level, at least the most we can do is कि यार अगर तुम्हें कोई चीज if there is something you are working on at that point, whatever it may be, keep on working on it, keep on producing, keep on publishing, and hope जब policy बन रही होती है ना, some not all the time, but sometimes they do look for evidence, right? और evidence वही है जो आपने produce करके publish किया होता है. So at your level, that is the most you can do. Other than that, keep working hard to get, because it's very difficult to kind of I know it sounds pessimistic working in a system like this, but that is the reality of the situation, and that is what we want to change. But change again does not come that fast. It takes time. Agar you have kya hai Gandhi ka, be the change you want to see, like this is what you are working towards essentially, right?
Right.
Amy Usmani has asked, what is the scope for a health economist in public health? A lot. We don't have any. We don't have a lot.
For health economists, yes, there's a lot of scope. I mean, जितनी भी project planning हो रही होती है, उसके अंदर financing, budgeting plays a huge role. So there is definitely a lot of scope, both internationally and nationally.
Yeah. And इतनी जैसे अभी जिस तरह climate change है, या these kind of hot topics that are coming up, पाकिस्तान में डेटा प्रोड्यूस नहीं हो रहा है which is showing कि जी इकोनॉमिक बर्डन क्या है, या what is the percentage of people who are being affected by it. Like we don't have people who are economists in public health. बहुत कम है, and यहाँ पे तो बहुत ज़्यादा स्कोप है क्योंकि लोग ही नहीं है.
और नीड भी है ना,
बहुत ज़्यादा नीड है. Great, I think that's all the questions. Anyone else have any question?
That's it.
I think that's it. All right. Thank you, Arfa, for this amazing
Thank you so much
session.
for having me,
And
Ramya.
of course,
And good to talk about something right I love.
I know it's fun to talk about this. And I hope हम ये करते रहें. Maybe we can keep talking on different topics, So guys, keep a lookout for that. And thank you again. And with that, I will say Khudafis.
Thank you for joining us, everyone, and thank you, Amna. Love this.
Khudafis.